Right now, we're joined by Dr. Jeffrey Potoff from UW Health to learn a little bit more. And before we get into the guidelines, I do want to ask you, how effective are masks?
The data around masks has changed so much during the pandemic, from early days wondering if we even should wear them if we didn't have symptoms, to really understand that they can significantly reduce transmission if both people in the interaction are masked. So it's a team sport, but it can significantly reduce transmission.
Dr. Potoff, we've been talking about the decline in COVID cases. When we're talking about the state of Wisconsin, could we see the CDC easing mask guidelines anytime soon?
Yeah, I think it's pretty likely that we could see guidance that eases mask guidelines. I think, what we're looking for is in the day of Omicron, what are some of those numbers? How many cases per 100,000 people do you need to be at for that to be safe? What percent positive tests need to be at for that to be safe? We have some of that data with earlier variants. We haven't seen it modeled for Omicron. That'll tell us when we can take away mask mandates, but also if we ever need them, when to put them back on.
Is there a timeline on when we can expect that to happen, in a couple of weeks, months, or do we not know?
I don't think we know for sure, but I imagine it would be the next week, maybe this week. If not, I'd imagine next week. Everyone is kind of looking to the CDC to provide some guidance around this.
Okay, and when we're talking about the subvariant BA2, what are the concerns with that? As we know, at least 45 states have reported cases of this. Is this something that we should be concerned about?
Concern might be too strong of a word. I do think we should keep an eye on it. It does look like it's a little bit more contagious than the initial kind of Omicron variant. Otherwise, it has similar factors. I think what will prohibit this variant from taking hold and causing another big surge is that there's a lot of people out there, either through vaccination or recent infection with Omicron, who are going to be relatively immune from this variant for at least the short future, the next, 1 to 2 months.
And are we still having conversations about herd immunity, with all these variants that are coming up? Is that still something that is achievable?
Yeah, I think that ship has sailed. With these really contagious variants, it takes really high numbers of people to be immune from the disease. Probably upwards of 90+% of folks either vaccinated or with durable protection from natural immunity. With the number of people who've chosen to be unvaccinated and the uncertainty around what kind of immunity you actually get if you come down with the disease, I think COVID-19 is something that's going to be with us for the long haul.
Are we still seeing the number of patients in the ICU with severe side effects from COVID-19? Are those still labeled as unvaccinated patients?
Yeah, looking through our data, we are seeing, especially in the ICU, a huge number of those people being unvaccinated compared against, what percent the unvaccinated are making up of the population. Thankfully, in general, COVID numbers are coming down, which is a welcome sight. But when you look in the ICU at who's doing really poorly, it's the unvaccinated.
All right, Dr. Jeffrey Potoff joining us live. Thank you so much.